Good afternoon, Eric Showalter, Foundation President here at Baton Rouge General, standing here with Dr. Stephen Briere. We spoke with Dr. Briere at the beginning of the COVID pandemic here back in March, and he's joining us here today to give us a brief update. Dr. Briere, thank you for taking a minute out of your very busy schedule to speak with us. Just want to ask you a couple questions. One is, how are we doing? What do things look like here at Baton Rouge General today?
Sure. We're doing well dealing with the pandemic right now. This pandemic's a little bit different than the previous pandemic in the fact that previously patients who didn't have coronavirus kind of disappeared and that volume of patients decreased and we weren't performing operations. Now there's a critical mass of patients who do not have coronavirus in the hospital who require critical care, and because we didn't do operations for a while, we need to keep our operative services rolling. That's occurring while we're having an increased volume of coronavirus patients, and so we're having to deal with all that. The nursing administration, the nurses, respiratory therapists, EVS, have all been fantastic. Everybody is stepping up again just like they did the first time. We have all hands on deck. Similar to the last time, we have expanded our ICU capacity and we have built plans to deal with this pandemic if it continues to grow. And so we're taking care of everybody. Our nurses are excited, our respiratory therapists are excited, EVS is helping, everybody is helping, and we're serving our community, which we feel is our responsibility.
We still have COVID patients coming in. At the same time, people are getting back to work. People are still going to the grocery stores. Do you have some tips? How do you go to the grocery store? How do you come into work to make sure that you're staying safe and keeping your staff safe? What are some tips that you have for us?
Sure. So I'm not going to the grocery store much. I'm working in the ICUs these days. But all of the CDC recommendations make sense, and these are now evidence-based. If we've had many months to go on this, we've actually studied, does the use of masks work? Yes, it helps decrease transmission of the virus and your risk of catching the virus. Hand washing is extremely important, and you need to understand that this virus can live on some surfaces for several days. And so after you touch things, you wash your hands. Those are the most important things. Be mindful to yourself in symptoms. This is not the time for you to disregard a low-grade fever or a cough or shortness of breath. If you feel you have these symptoms, please come. If you know someone who has these symptoms, be extra diligent in your social distancing with them, even if they're a family member.
What have we learned about the virus? Is there anything that we've learned since the last time you and I spoke that you think is significant or important for people to know?
Yeah, so we've learned quite a bit as far as the critical care management. We're all aware that there are probably 2 medications now which were not part of our usual care armamentarium. The first one, remdesivir, is the antiviral drug that was recently studied in the United States, and then dexamethasone from the European data has also been shown to be beneficial. We're very fortunate at Baton Rouge General. We are enrolled within a study of remdesivir, so we have plenty of the drug available, and we assured that we'd have plenty of dexamethasone available for our patients after the first publication that came out regarding its efficacy. We've learned a fair amount about managing people with respiratory failure. At first we thought it was best to put them immediately on ventilators or breathing machines. Now we use non-invasive ventilators much more frequently. We've learned how to manage fluids and things like that. And I think maybe one of the most important things we've done is we've learned how to adapt to those restrictions on patient visitation and keeping the family and the patient comfortable in the ICU and updated throughout their course. The families are so appreciative when we call them every day and we FaceTime them, and we recognize the importance that their loved one is in the hospital. We hate that they can't visit them. That is merely to protect them and the rest of the community, but we are communicating with them every day.
Thank you, Dr. Briere. We appreciate your time. The staff here is just being unbelievable. The donor base, the community, for your support, the things that you're allowing us to do and provide for our care teams like Dr. Briere and his staff. We appreciate you so much, and thank you, Dr. Briere, for joining us today, and thanks for all you do.